Good evening, everyone.
Mind amazing.
And Nehru Science Center once again is with one more virtual program, panel discussion, and on very relevant topic, and which is the need of the hour, COVID-19 and mental health. So today we are going to have a very important panel discussion. So we have galaxy of panelists. They are very renowned experts in their own respective fields. So I would introduce first Dr. Vihang Vaiya. He is very famous
Hi.
in Vihang Vaiya, sir. Yeah.
Hello.
Hello, good evening, sir. So Dr. Vaiya
Good evening.
is, good evening, sir. So Dr. Vaiya is known for psychiatry. He is former professor of psychiatry of Cooper Hospital, Mumbai, and consultant psychiatrist at Breach Candy Hospital and Lilavati Hospitals. And he is a renowned name in this field for all of us. And we have another expert with us, Dr. Alka Subramaniam ji. She is a professor in the Department of Psychiatry of Topiwala National Medical College and VYL Nayar Charitable Hospital, Mumbai. And she is very much known in, she also says this stress or is also kind of epidemic. So she is very much interested in this field and she is working since along the way. And we have another expert. Dr. Mala Vinod Kaneria ji. She is a professor and unit head at Topiwala National Medical College and BYL Nayar Charitable Hospital, Mumbai, and also Kasturba Hospital for Infectious Diseases. Dr. Mala is also a consultant in infectious diseases at Jaslok Hospital and Research Center, Mumbai. And thank you, ma'am, for joining us and giving your quality of time in this critical time where we are all facing lockdown. And we have with us our director, Sri Prasad Kenneth, sir, who is going to moderate this program. So, sir, the stage is yours. Please go ahead, sir.
Once again, a big welcome. All the three of you have been experiencing the COVID situation now. It has never happened in the history of India that we have locked down ourselves for about 21 days. And just this morning, the Honorable Prime Minister has extended this up to the 3rd of May, primarily because the United States already reached a number of about 6 lakh and we are close to about 2 million affected people with 1,20,000 deaths. In India, about 10,000 plus COVID cases with 300 plus deaths. Under these circumstances, all the media has been covering about the health issues, the do's and don'ts, etc. But what we need to cover in this extensively is the anxiety that comes with this, the helplessness, the anger, the insecurity. So that's the reason I think we'll start with this. So may I request Dr. Vaiya, what do you say about the anxiety and stress level that we all are passing through?
Thank you, Dr. Kenneth. I have my way of looking at this slightly different from what the newspapers and the TV media tell us. We are 1.3 billion Indians, more than 1.3 billion Indians, of which approximately 10,000, more than 10,000, about 12,000 are currently infected with this coronavirus, which means 1.3 billion amongst us are not infected with this virus. Even if the number of people infected with the virus increases by 4 times, a large majority amongst us are not going to be infected, and we want to keep it that way. So to do that, there are a whole lot of physical measures like physical distancing. The social distancing is a misnomer. It should be physical distancing and enhanced socialization. We need to have as much virtual interaction as possible for our own health. Having said that, there is one segment of society which is over busy, like Dr. Alka, for example. They are very busy. Or this young lady, the physician, she's very, very busy doing a whole lot of things. They have not enough time to even rest for themselves. But a large segment of the society today is experiencing a virtual concentration camp-like situation. We are in our house. We can look upon it as being locked in the house, or we can say, thank God, we are safe in our house. In a situation like this, worry about the future, about managing finances, the boredom of monotony, depression because we are helpless, a sense of anger and hostility are bound to occur. The psychological phase runs into 4 stages. The first is denial. It's not going to happen. This is nothing very wrong. WHO also said initially that this is not a pandemic. The second is who's to blame. We have to find faults with somebody else. This didn't happen right, that didn't happen right. There's this fault finding phase. The third phase is, kind of some kind of, give and take, a kind of maneuvering or manipulating. I'll do this, I'll do that. Ordinarily, there would have been a lot of religious activity. That has stopped. All temples, priests, mosques and churches are closed. So we don't have that passive anxiety relieving phenomena where we could blame the God for everything. Now we have to do something. So what do we have to do is to control our thoughts and anger and control our temperature. When we think too much, we get that vicharon ki garmi. So control it and think positive. Think of what we can do and so on and so on. I'm sure Dr. Alka will have much more to say because she has hands-on experience on what happens to the psychology of patients who keep visiting the Nair Hospital. We got 2 physicians from Nair Hospital and they are both hands-on experience.
We also have with us Dr. Mala Kaneria ji, who is a physician. I'm sure, ma'am, it's known now that everybody knows that this particular COVID does not have any medicine or vaccine. So medicine we can't take. The only, as things stand today, the physical distancing or maybe confining ourselves in our own room and try as far as possible not to be, not to get affected with this. Under these circumstances, what do you say as a physician that, how do we tackle this?
A global crisis of this magnitude has never been seen since World War II. And I think every aspect of our lives are going to be affected by this, be it behavioral, be it economic, be it social. And now we are going to see new norms which are going to come up. Handshakes and hugs are going to be replaced by some other form of greeting. And hand hygiene is going to be followed like nothing before. So everyone needs to be aware that majority of the population is eventually going to be affected. There is no escape from this infection at all. And the majority, almost 81% people are going to develop asymptomatic infection or mild infection. It is only a very small percentage of the people, say around 12.5%, who are in a vulnerable group, such as the elderly or who have some comorbidities like a heart problem or an underlying respiratory problem or who are immunocompromised due to malignancy or transplants. These are the ones who are more likely to have a more fatal form of the disease. So majority of us are going to become immunized eventually. So there is no way in which we can hide from this virus. Eventually, we will all have to leave our house with great amount of trepidation and caution. And we must accept the fact that because this virus is a totally new virus, nothing like which was seen before, there is no herd immunity which is usually there in a group of people because of which we can fight the infection. And like you correctly mentioned, there is no known medicine or vaccine for this infection. So people will have to accept that the only way in which you can probably prevent yourself from this infection is hand hygiene, which one has to follow meticulously, religiously, and fanatically. Social distancing or physical distancing, actually more than social distancing, is very important, where you have to be at least 3 to 6 feet away. You have to follow respiratory hygiene. And one must also remember the fact that this is not going to be for just 2 or 3 months. It may last for 6 to 8 months or maybe even longer, because the vaccine is a very, very long time away. For a good vaccine to come up, actually you need at least 12 to 18 months. You cannot have it sooner to say that it is safe and efficacious. So one has to be prepared mentally and physically to deal with a situation which has never happened before in probably the history of humanity, where we are under a total lockdown, where the lockdown is going to be extended. And after that also, the lockdown is going to be relaxed in a very phased out manner. So this abnormal situation is going to last for a very, very long time. There are patients who are suffering from known COVID medical problems like hypertension or diabetes or abdominal pain, who will not be able to go to a hospital because of this COVID scenario. but eventually they will have to leave their homes for any medical emergency or any medical situation, and will do so with caution. So this is something which we really need to put it in our head, that things are not going to magically and miraculously improve after 2 weeks or 3 weeks or 1 month and all. And we need to be prepared for this in every possible way. Meanwhile, researchers and scientists are carrying on their job. They are trying to find out new medicines and vaccines, but we are a long, long way off, and we need to deal with the situation and test more, and probably just accept the fact that now it is just tracing and quarantine and isolation that is going to work.
Alka ma'am, there is a paradoxical situation here. One is that there are a group of people who are overworked or extremely busy, maybe working 20 hours a day, which includes you, the front-end doctor, who is handling the cases, and also all other health workers, the security staff, and the people who take care of the cleanliness. But then there is another group of people who are maybe bored, or they don't have any work, sitting at home. They too are equally stressed. This is a paradoxical situation here. And of course, there are people who have lost their jobs and livelihood. The government is trying its best to try and mitigate their hardship. So how do you address these issues that one group of people are extremely busy, stressed, the other group is also stressed?
So what has happened in this whole situation, because the situation is abnormal. We cannot call it normal in any way. It has changed our baseline, or the norm, as we call it. So what used to be routines for us have now changed, whether it is for the healthcare workers or whether it is for those who are sitting at home, right? And in that change, it becomes very important for us to adapt that change and create a new routine. Like Dr. Vahia said, you need to establish contact with people online, just like we are doing now. This is the first experiment where we are having a panel discussion online, which we would never have done earlier. So coming to that, I actually think that the government has done very good measures to allay anxiety, which could have been really bad. If they told you on 22nd of March that you're going to extend till 3rd of May, we would have had many more people collapsing. It's gone in a very strategically in a phasic manner. We'll watch for 15 days, then after 15 days, let's take a call. And then now we're going to check on the 20th, how are things going to be? By the end of the first 15 days, most people had recognized that this is a measure that requires taken our safety. We're willing to abide by it. The police force, the containment zones, the whole world saying that India has taken such a good stance by early lockdown, because we don't have the healthcare infrastructure to support our numbers. 1.3 billion is a staggering amount of population and the density per area, right? So all these measures, people have started understanding that this is for our benefit. Number two, when we talk about the people at the lower socioeconomic strata, they have been assured that they will be getting their wages, and most employers are looking forward to giving it to them because they realize that this is a forced situation. Many have reached out to them and said, how are you doing? Are you staying at home? Please don't step out, so on and so forth, right? Now, being at home, what becomes important for every person, irrespective of the age group, is to sort of create a routine. So you get up in the morning, do your regular exercise. You could have a Zoom exercise, whether you're a small toddler, you're a person who's 70, 80 years old. Do some cleaning in the house, which is exercise by itself, right? Doing one jhadu katka and cleaning bathrooms, you can understand how it is. Then meet with people online, do something in that measure so that at least your socialization, your networking works. You'll be cooking, you'll be maybe playing a game with the family. For those who are working online, there are other people in the buildings who are reaching out to them and providing them like with a dabba service, which actually helps your cohesiveness as a society, and it also helps the spiritual domain. So these are things which we can actually work towards getting the normalization or our baseline changed. Similarly, for healthcare workers, which is an international norm, is no healthcare worker should ideally be exposed for duties more than 6 hours, which we are strictly following, and Mala will vouch for that, in all the doctors, right? But where the sanitation workers are concerned and the security is concerned, they have a slightly longer duty, but then they also take it in stages and they have groups and they are managing that. And there's a lot of hands-on psychological support. So everyone in the world is talking about PPE, which is personal protective equipment, which is a physical barrier to prevent the virus. And I love this term, which I've got from a colleague of mine in the UK, called psychological PPE, which we really need to work on for us to combat this virus, because the resilience required over the next few months could stretch even as so long as 6 months, 8 months, we don't know, is going to be a long time.
You used an interesting term, that a psychological PPE. You mean to say that there's going to be some kind of a placebo effect on, at least, can this placebo come into the community as well? That, we are
no
safe.
Placebo. This is not a placebo. This is a volitional means of actually improving your the brain function by realizing and recognizing that certain routines are important. For example, like children can, they've already started Zoom classes with them so that they have a routine. So they have 4 to 5 hours of school sitting at home. Then they meet up with their friends online, maybe an hour. And I've actually had younger children who play hide and seek, and we tell their parents, go ahead. I mean, how does it matter? Let them do what they want to do. So this is all this activity increases your endorphin release, and it actually helps with the stress, your immune response. And we know that COVID has a very strong inflammatory and immune response. So for an elder person who used to go out to the park and have participate in the senior citizens club, in the laughter club, we say, have a laughter club at 7 in the morning with your friends. Don't stop. Just find an alternative means of doing it, because this again releases endorphins in a natural way, and that's exactly what we want. We want to boost the immunity besides the vitamin C, vitamin D, and for health workers, the HCQ.
This is interesting, Dr. Wahia. I mean, you have this Darwin's theory of evolution. We get on the origin of species. So is this going to happen to us, that this is the new norm? So we are going to adapt ourselves over a long haul?
So thank you. Well, Dr. Alka has very nicely covered a whole lot of psychological spectrum of events. Let's realize that nobody likes a pandemic. Nobody invited it, nobody likes it, but it has occurred. No matter how angry we feel or upset we feel, it's going to stay. So the Darwin's theory of survival of the fittest is reinterpreted to say that fitness is not in the form of physical fitness, but a person who's fit to adapt. So the Darwin's theory of survival of the fittest means people who can adapt are the ones who survive. In this current situation, feeling lonely, feeling left out, feeling secluded is not a pleasant thing to happen. And then people are at risk of developing a learned helplessness. I can't help myself. I can't help the situation. I'm stuck. There is nothing I can do. And I'm now doomed. We've got to get out of it. The way to get out of it is to realize that this is not the first time in our life that we are facing a difficulty of whatever kind. Okay, this is a global difficulty. The only superpower in the world today is the coronavirus. But the whole issue is, no matter how powerful a superior force tried to snub us, we have survived in the past, individually. Now we are going to survive collectively. So let's develop that attitude that we can survive. Let's not start feeling helpless or kind of, emotionally lose the battle against the coronavirus. This virus is not going to wipe the humans out of the surface of the earth. So having said that, it's time to introspect. Instead of getting swayed by the negative emotions of worry, anger, hostility, or helplessness, let's say, what is it that I can do? So for that, there are a couple of exercises that I learned. One was that in the absence of sports, actual sports, like Dr. Alka so nicely said, have a virtual laughter club on the Zoom. Get all your friends to come on the Zoom and have your laughter clubs. Try and start doing things that don't make you feel upset with yourself. So know what you are good at, and whatever that you are good at, how can you now bring it up in the current situation of virtual context, not physical context. Figure out how can we help others in this moment of difficulty. It might be supplying a meal to your neighbor, or it might be supplying some clothes and water bottles to the sanitary and a policeman when we are driving along the road. Some of us need to drive along the road, and we find these policemen and sanitary workers on the street. Just say hello to them, offer them a drink of water or a sanitizer. It works. And most of all is, don't develop a sense of guilt. Don't feel you're not doing enough for yourself, for your family, for your friends. Establish contact. Dr. Alka said, have socializing. My one addition to that is socializing in the form of WhatsApp and SMS messaging and internet is fine. As far as possible, speak to them. Talk to people. Humans can talk. So let's talk. Talk to our friends, old friends, even our enemies, and say how. If somebody has been upset or you've been upset with someone, just call up and say, hey, how are you doing during this crisis? It reestablishes healthy relationship. Talk to people. Virtual relationship in the form of talk, not just the electronic media. That is one thing, and adapt. We are going to face this, and we are going to find ways of dealing with it. Not say, okay, this has happened, I don't know how to deal with it, and don't lose the battle. Third,
thank you so much.
Just one more, don't anticipate what's going to go wrong. Think of what's going to go right. Thank you.
Dr. Mala, I mean, you said that there'll be people, lots of people with asymptomatic symptoms, I mean, which are not manifested, and maybe about 12% of people are going to be affected. How do we know that, whether we should get tested ourselves? Say I don't have any of these fever or some other symptoms, flu-like symptoms. So who are the people who are supposed to go and test?
In this particular infection, it is in 4 stages. One is when this infection was brought into the country, this virus was brought into the country through foreign transmission. Something started in China. From China, gradually it went to all the countries. And finally, it came to India somewhere in Jan. After that, the people who brought this virus into the country, they gave rise to something called as local transmission, where all their contacts got affected. And after that, gradually, we started seeing around 7 days or ago, some extent of community transmission, which is stage 3. So now we are between stage 2 and stage 3. So all the people, initially the people who were actually getting affected and who should be tested are the ones who have traveled from abroad and who are contacts of these people who have traveled from abroad. But now when we are seeing community transmission, anyone who's got a respiratory infection and who's got more than mild symptoms, even if that person does not have a travel history or a history of contact with someone who has a travel history, probably needs to think of getting tested. But all people who are mildly affected or who are asymptomatic, they probably should not be tested. But individuals who have got more than mild symptoms, moderate symptoms, especially who are in the vulnerable groups, such as patients who are elderly more than 60 years or have got existing comorbidities such as uncontrolled hypertension or diabetes, or patients of cardiac disease, or patients who have undergone transplant, or who have got some malignancy, we are the people who should get tested. But now, because there is community transmission, this kind of testing zones are getting kind of blurred. So now any patient who has got flu and any patient who is symptomatic and who's come up for testing is being tested. And if they test positive, then their contacts are being traced. And all the contacts which the person has come across in the past 14 days, those are being tested after being quarantined. And this is how we are going about it, because currently we are between stage 2 and stage 3, but there is a limit to testing. So eventually we will need to take a call as to what is our capacity for testing, because countries like South Korea, where they have actually gone on testing everyone, they probably have a very robust public healthcare system where they had the capacity to test everyone. But India probably does not have that. So currently we are trying to test everyone who are in these hotspots or these containment zones. For example, areas of Dharavi or Worli, which are the containment zones. These hotspots are being tested. Currently, we are using the RT-PCR testing, which is the nasopharyngeal or throat swab. Now, in a very short while, it's another 10 days or so, we are going to lay our hands on the antibody test, and we will start doing antibody tests on a lot of people. And that is going to decide which groups of people are going to require the RT-PCR testing. Now, antibody testing, when it comes, an antibody test are shown to be positive, it is going to have a continuing of manifestations, in the sense a patient who has got IgG positive probably has become immune and had asymptomatic infection or mild infection and has escaped the virus. A person with IgM antibodies probably has an acute infection. There the RT-PCR will have to be done. So these are the ways in which we are going about and seeing how we go ahead from here.
So we had this two events which where the whole nation joined. One was the clapping for in reverence of the frontline doctors like you, which the whole nation joined. The second one was the symbolic representation of putting off our lights and turning on the candles. What do you say about this? How does it psychologically, or how does it affect the spirit of the country?
So it's a very good measure for a cohesive spirit, because what we want to show is that we stand united. Unfortunately, like I said earlier, density is so high that the Thali one, which was the first one, had people coming out on the streets where physical distancing, social distancing was not maintained, right? So therefore, I think that the second time round, they said just light a diya in your house. So at least everybody knows that we are all in it together and we're going to try and fight it together. So in a way, it's a measure which works towards that. And physically, we are saying that, yes, we are trying to fight this illness, and we have some measure or a prayer which we all put out, irrespective across caste, creed, religion, which really helps. Whilst we are on it, I just feel it's very important at this point to mention that there are patients who are actually have started committing suicide because of their COVID status. So it is a very fine line between what we are getting bombarded on social media, and it's important to limit Corona time for everyone, as I call it, Corona time. So in that routine of normalization, everybody should have, say, 1 hour or half an hour of Corona time in the morning and Corona time in the evening, and not throughout the day dedicate yourself and your life towards Corona. It's not required. And
thank you so much.
Advocacy and awareness that if you have symptoms of anxiety or suicide, particularly related to this, do approach a mental health professional. There is no reason why anyone should die because of an anticipation that they're going to die because of Corona.
Thank you so much. And the government also has introduced a new app, Arogya Setu, which can actually trace people, and it's perhaps going to help us as well. I'd like to thank all the three of you doctors for joining us virtually. Of course, for the first time we are trying. This is a new norm for us as well, and hopefully we'll pass through this. Thank you.
Stay safe. Stay at home.
Thank you.
Thank you.
Thank you, everyone, and please do like our Facebook page and subscribe to YouTube channel, ma'am, in this world critical time, and visit our website for knowing more events which are upcoming. Thank you, everyone, once again.
Thank you. Thank you.